to the third part of this lecture, which is on the core areas in public health provided in Malaysia. In general, most health divisions in each state covers the following important key areas: disease control, family health, food quality control, health education, and dental. The core components of disease control includes vector control, communicable disease control, and non-communicable disease control. Examples of vector control are malaria program, dengue control, and other vectors. We see about 40,000 cases of malaria every year, which is mostly found in Sabah. There are many illegal immigrants, and the parasites involved are Plasmodium falciparum, Vivax, malaria, and ovale. Mosquitoes involved are Anopheles especially. There are also other mosquitoes involved, which includes Maculatus, Campasterius, Sundaicus, and Balabacensis. Dengue happens mostly in urban areas. It is caused by Aedes aegypti and Aedes albopictus as the vectors. Both the local authorities and Ministry of Health is involved in controlling dengue cases. For the communicable disease section, these are some of the diseases that it's being controlled: cholera, typhoid, diarrheal diseases, and other communicable diseases. For example, under the HIV/AIDS unit, most of the HIV cases are seen here and reported. There are about 40,000 cases per year, and AIDS is about 4,000 cases. Majority of these patients and also the staff works with the NGOs or the non-governmental organizations. Non-communicable diseases covers hypertension, cancers, and diabetes. In the family health division, there are three main areas which is being covered. They are the primary care unit, maternal and child health unit, and also the nutrition unit. In the primary care unit, the hospital outpatient department is also included in the primary care division. They have tele-primary care, and there are also expanded scope of primary care. The maternal and child health covers maternal care, child health, neonatal, and perinatal care. Under the nutrition, there are several programs involved. There is the maternal nutrition, the child health nutrition, Kesihatan Zat Makanan or KZM, PPRT for the hardcore poor, the National Plan Nutrition, the breastfeeding, and baby-friendly hospital programs. The food quality control covers a few areas. It is involved in the implementation of the Food Act and the food regulations, sampling of food quality, having food inspection, food labeling, food laboratory, closure of food outlets, and hazard analysis and critical control point training and monitoring. For the health education unit, here are some of the activities done in this division. They do production of health education material, they distribute the health education material, they do training, and there is the healthy lifestyle campaign. Support services covers the pharmacy division, the engineering division, the research, which is under the National Institutes of Health or NIH, the planning and development division. Under the Institutes of National Institutes of Health, there are several institutes. There is the Institute for Medical Research or IMR, Institute for Public Health or IKU, Clinical Research Center or CRC, Institute for Health Management IHM, Institute for Health System Research or IHSR, and Institute for Health Behavior Research IHBR. Under the pharmacy division, They look at the production, the registration, and also there is a bureau for inspection and raids to check poisons which are not misused. In the production, the quality of the pharmacy product is taken care of. For registration, component, new drugs, cosmetics, traditional medicine, poisons of import, and factories producing drug, including the good manufacturing practice, is being captured and being done. Under the engineering division, there is the hospital engineering, the health aspect, and also implementing and training for ISO 9000. The private projects in the hospital, which includes waste disposal, laundry, maintenance of equipment, are also being monitored under the hospital engineering division. In coordinating research, IMR coordinates the clinical research, IKU does the health systems research and training of public health nurses and also the health inspectors. Under the Planning and Development Division, for macro planning, there is planning for clinics and hospitals, and micro planning, it coordinates with EPU or the Economic Planning Unit and international agencies such as ADB, Asian Development Bank, and WB, which is the World Bank. This concludes the third and last part of this lecture, which is on the core areas in public health provided in Malaysia. Here are some additional reading materials which will provide more detailed discussion on the issues I have mentioned. Before I end, I would like to summarize the main points in this lecture on the general introduction into the health services in Malaysia. The first is an overview of Malaysia and the health services in Malaysia. The second is the organization and structure of the health services in Malaysia. The last is the core public health areas provided in Malaysia. This is an example of our country's health system to ensure universal health coverage for its population. Thank you.